So what is sickle cell disease? Well, it's a genetic autosomal recessive condition. That means you need 2 genes in order to have the disease. And that means 1 gene has to come from each parent. And because this gene originated in Africa, it's more commonly found in Black individuals. So red blood cells are usually a nice round donut shape so they can easily flow through those blood vessels. So what happens in sickle cell disease? Well, these red blood cells turn into a C-shaped sickle cell and they become sticky and they clump together in the blood vessels and cause a traffic jam. That leads to decreased perfusion and therefore hypoxia and ischemia. We also see that these red blood cells don't last as long as a normal red blood cell. So normal red blood cells will last about 120 days, while these sickle-shaped cells only last about 10 to 20 days. That leads to increased red blood cell destruction and therefore anemia. That also, in turn, causes decreased perfusion. So what do these clients look like? Well, because they have a decreased number of red blood cells, that leads to anemia and decreased perfusion, and therefore it causes decreased oxygenation. So we see fatigue and pallor, and because of chronic decreased perfusion, it causes delayed growth. Because we have increased red blood cell destruction, where do those red blood cells go to die? Well, they go to the spleen, and that spleen becomes overwhelmed with all those sickled cells and becomes congested and enlarged, and that causes chronic splenomegaly or an enlarged spleen. Over time, that congested spleen becomes damaged, and because the spleen is so important for the immune system, it can increase infection risk in our sickle cell clients. Because there's increased red blood cell destruction, that leads to increased byproducts of that red blood cell destruction, like bilirubin. And increased bilirubin in the blood causes yellow discoloration of the skin, known as jaundice. And remember, jaundice is really hard to assess in our darker skinned clients. So if the NCLEX gives you a client who has darker skin, where do we assess jaundice? We assess darker skin clients with more pigment in their skin in less pigmented areas, like the sclera of the eye and the mucous membranes like inside of the mouth.